Thanks for joining us tonight. I know it's Tuesday. You guys probably work today. We're going to go through digital scanners and how to utilize them in your office. I'm going to get cranked through. We will answer questions at the end. So Jordan and Aaron are keeping tabs of any questions put in. I can really only see my screen during this as we pop in and out. If they have something that I need to answer along with it, they'll let me know. But I'm an open book and just look forward to getting you guys some insight into how to bring digital scanners into your practice. So just a little bit about me. I'm born and raised right outside Tampa, Florida in Brandon. Went to Nova for dental school, University of Florida for pediatrics. I own a office just south of Tampa in Apollo Beach where I have my practice Smile and Pediatric Dentistry. This is part of my team. And then I run a tongue tie center out of my office as well. So today, our main goals, like we're going to understand the benefits of digital scanning, like why you can utilize them, why I utilize them, explore like how to use them clinically in your office in replacing physical impressions. We're going to learn how to do some scanning techniques. At the end of the day, they're a very easy tool to learn. We learn in a pretty tech advanced world nowadays, and putting these in your practice is a simple learning curve for most of your team members and an easy way to kind of promote yourself differently and workflow differently. So the workflow is huge. Like that's one of the biggest takeaways is the ability to work smooth and easy and have very simple appointments for your patients and have parents who are happy because the appointments were easy. And then obviously everything costs money. If you're a practice owner, you understand that you have to think about investments you make for your practice. So we'll talk about some of the financial implications and advantages of integrating digital scanning into your office and how to make it a positive ROI. Both automatically and in the long run. All right. So why am I here? Because I own a scanner. No, I own the new Smile scanner, and I've been using it since June of 2023. I still have not taken a physical impression since I've put it in my office. It's awesome. I still have some trays tucked somewhere. I still have some impression material somewhere, just in case you need it for a rainy day. But it is something we've integrated pretty seamlessly into the office. It's kind of wild to think it was 2023 when I put it in there because it's something we use every day. I don't think I could ever go back to taking physical impressions. And very happy with that purchase. We've integrated in the team by kind of giving them the ability to learn how to use it on each other, on patients, doing little kind of lunch and learns with it. It is a very easy to use, easy to install, easy to kind of put into your day-to-day routine. It makes your job as a doctor easier. It makes those impression appointments faster, and turnaround with the labs are even quicker as well. And then for me in our office, we're very committed to using the latest technology. Like we are in another little boom of tech with AI and all the other digital formats that we can put into our office. As pediatric specialists, we don't do as much fancy 3D printing and milled crowns as other doctors as of now. I think that is something that will change in the future. And I'm wanting to make sure I am at the cusp of learning those techniques, integrating into the office, just to promote that we're giving the best kind of care and the easiest care for kids. And with kids, that's one of the biggest things is making the appointments not only successful, but as easy as possible for all parties, the doctor, the parent, and the patient. So big benefits. For me, like I hated the 8-year-old on my schedule that was there for a full arch impression. A lot of times those arches are not very developed. Getting a full tray in there is not pleasant. We've all taken a million impressions on each other in dental school. If you got a gag reflex or claustrophobic or just don't like oral stimulation, it makes it a harder appointment, and you need that alginate or PVS to set. Sometimes you're taking multiple impressions. Sometimes you don't get the landmarks you need. Going to this has been extremely beneficial, and I never worried about an impression anymore. Not on scared kids, not on special needs kids, because they like to play with it. It's cool to them. It's like a video game. It is also very nice because my assistants can do all of the work. I can have them set up and say, hey, I need an impression of this. I pop back in, make sure it looks good. They do the lab script, which will roll through the Neo lab portion that I utilize for our lab appliances and how easy that is. And then, I sign off just like any lab script, and it's off to the races and it comes back perfect. It's easy for your assistants to learn. If you have younger assistants, I'd say super, super easy for them to learn. If you have older assistants, assistants, still easy for them to learn. Even my older assistants who are much veteran to me, have picked it up easily, and by practicing on each other and just rolling through it with patients, have gotten really good at using it day to day. It's not messy. You don't have to worry about cleanup with alginates, stone, anything like that. You don't have to worry about your sink getting clogged or any issues there. The other aspect that I didn't think of off the top was I don't have to keep alginate inventory, no storage. I also don't have to keep any impressions that I took or stone models that I took, because everything is in the cloud, which makes for a very, smooth storage space in your dental office, which is very necessary. We all run out of space. We all need more of it. And there's only so many square foot of clinical opportunities. So we have to maximize those so we can get that ROI we need. And then obviously happy patients, impressed parents. Like that's huge. Like parents go and talk to their friends. Oh, like my kid had to get one of those appliances, but it was super easy. They didn't have to take double arch impressions, blah, blah, blah. Word of mouth is what you want as a pediatric specialist, because you can have a million Google reviews, but if the moms are talking about you on the neighborhood pages, you're in good standing, and that's what we all want. Efficiency, obviously, that's a big thing in the office. We work heavy patient loads. We are bouncing chair to chair. We want to make sure that those appointments count production wise, so we can do well as an office, pay our team well, and do well as a professional. The accuracy of the scans just makes it a simple process, because when that appliance comes back from the lab, it's going to fit like a glove every time. And you can see in 3 dimensions every aspect of your impression before you send it off. So you can make sure all your landmarks are there. For simple appliances, it is very, very easy. And even for more in-depth appliances or ortho needs, it's, again, simple to do if you need a double arch and a bite. The faster chair time just makes for more appointments per day, better business. Like you can turn things over quicker. Instead of having a 30-minute appointment, you can have a 15-minute appointment. If it's a really tough kid, instead of having a 45-minute impression, you're going to have a 10-minute impression. And then you can get somebody else in that chair that hour. Make some real production time. And then the turnaround from the lab is much smoother, just because there's less back and forth with a bad impression or something coming back from the lab not fitting because of distortion, maybe on your end, maybe on their end. I know we all remember dental school. There's a lot of steps in that kind of physical process where inaccuracy can occur. And it just makes for being more accurate, which it equates to better efficiency. The integration aspect makes it super simple. It's fully compatible with other techs. It's an STL file after you take the image. I had a buddy who lives or practices in Jacksonville, has a patient of his who is in college closer to Sarasota, south of me. She needed a new retainer. She didn't have time to go to Jacksonville. She popped up 20-minute drive to my office. I scanned and had that STL file to his office within 5 minutes, just to help him out and helped her out as a college student. Those kind of things, just this makes it possible. I didn't have to pour anything. I didn't have to mail it. It was all just an email and click away. And then the indirect banding is really nice. This is something I had never done previously. I was always kind of taught and very meticulous on, I want to take that impression. I want to put my own bands in that impression. I used to secure my bands with staples to make sure that the bands were exactly where I put them, and then I would ship it out. With the indirect banding, you can just take the scan, send it to the lab, and it's going to fit like a glove every time. And they come with a lot of different opportunities for how you want a band and or occlusal coverage kind of 3D printed option to fit. And we'll kind of talk through some of those benefits as we're going through the lecture. So the main reason I chose Allied Star, I went through looking at a lot of different scanners. Cost effective was a big one. Like I tried to be financially savvy for my office. I know you have to spend money to make money. But at the end of the day, you have to be responsible. Like you have yourself to take care of. You also have a team and you're taking care of all of them. You need to make sure any big investments you make in the practice are going to be beneficial. So looking through all of them, I wanted something that was easy to use, very kind of size, easy for kids. The cordless for me is huge. Like I hate having cords in the office. We have enough things to trip over, and we always have other kids and family members rolling in and out of the ops. So the fact that this came as a cordless option, it was fully packaged where I didn't have to go talk to my IT guy and get a laptop with it. It already came with the software, everything previously uploaded into the laptop, which made it a plug and play. And Jordan will roll through kind of how to set up one of the scanners and how simple it is. It also came with a 3-year warranty. So it's like, hey, I can use this for 3 years. We can bang it around a little bit. We can make sure it's gonna hold up the test of time in a sense. And we've, knock on wood, had no issues with ours. Haven't even had to touch the warranty. The kind of aspect of getting the scan done and the user friendly was huge. It was very simple to set up, scan, save, and integrate into your lab. And with DAs, like some are quick learners, some are slow learners. I wanted that to be one of the easiest steps for them to kind of get this new in, and bringing new into the office can be tough sometimes if people don't like change. But that made it simple for us. And then the tip size, like you have tip options for here. You can put a smaller tip on for those really, limited openers and small mouse. And then you also have a bigger tip for your teen patients and older adolescents that don't have an issue with anything in their mouth. My biggest thing is no recurrent costs. Like I hate getting nickel and dime by big companies that want a monthly fee for nothing and make it very prohibitive for you to utilize other labs, other services, and not fully integrate into your softwares. And that was the biggest, one of the bigger ones is the open architecture. Like I did not want anything that would not allow me to use who I wanted to. I do a lot of my appliances through NeoLab. I also do some fancy cosmetic work on peg laterals that I send to other adult labs. This has made it super, super simple where I can just get that scan, send it out, get wax ups done, or get my appliances made and not have any issues with it. And the partnership with NeoLab made it very simple. We'll talk a little bit about NeoLab, how they integrate kind of into your software. You can use your own lab. Anybody that accepts an STL file is available. I've just used NeoLab from the jump just because it was easy. And the process overall has made me a believer in them. And I don't find myself looking to switch anytime soon. So this is a great comparison of some of the bigger named out there. The Allied Star, those are the AS. You have the 260 and the 200E. The 200E is your wireless. The 260 is your wired. They're very, very similar in kind of feel, look, use. The weights are a little different. Obviously, if you have a no cord option, you're going to have a little more integrated into it, a little bit heavier, but it's still very light in your hand. No monthly fees was huge. Like I did not want to be nickel and dimed with anything there. There's no calibration issues. You get multiple tips. And it is really made for pediatric dentistry. The team over at Voxel, had pediatric dentistry in mind when they did this. For me, anything that's made for us that is cost effective, easy to use, it's a no brainer all around. I used iTeros in dental school. I looked at the Medits extensively. I've used the Trios in dental school. I've never used the Dexis. But when comparing them all, it really, was a no brainer to me. That's why I'm here telling you guys about all these benefits. Now, the biggest kind of things that you'll get right away are your workflow, like how easy it is to get your impressions, how easy it is to send that out. You don't have to pour any models. You're not trimming anything up. You're not shipping it out. You can get really quick turnaround on the lab case because it's all, there's no snail mail action going on. And with NeoLab, it's nice because you can like kind of stack your cases and get them all shipped out together. Which cuts down on shipping costs, and then you're only shipping one way as opposed to two. Again, you're going to make some money back just doing that. So these are like your slow and steady ROI builders. Like you're going to kind of not spend as much time, have more production in your office. You're going to make your team happier because they don't have to do all the busy work, and they can be actually productive doing other things in the office. And then you're going to have your cases turn around smooth because everything's going to fit really well. Typically, just looking at this stuff, the digital impressions are going to pay themselves off within just a couple of years. For me, that was enough. Like I try to do everything I can to make my team's life as easy as possible. Because if they're happy, they're working harder and making your patients happier. And in the long run, you have a more successful office. So we're going to do a little kind of step-by-step like walkthrough of setting it up. And then we'll talk about how to start scanning. We'll troubleshoot a little bit. A lot of the troubleshooting just comes from practice and playing with it on a typodont, on each other, getting in each other's mouth over lunch, before work, after work, and then obviously practicing on your patients. It's just like anything in dentistry when you're working, if you're adjusting yourself as you're moving through the mouth, you're going to be in a better spot. And the reorientation kind of process with this, if you lose where you're at in your scan, is extremely simple because you just like kind of wander back to any area that you've already scanned. A little box will turn green, which you guys will see, and it's going to pick that scan up, allow us to just kind of keep going, get all the landmarks you need. And if you need to touch something up, you can just kind of jump back in and do that pretty easily. I'm going to keep rolling through here, and this is Jordan. So I'm going to let him jump, and I'll press play here so he can show you how to set it up. This is the corded version, almost the exact same process as the cordless.
Yeah, so all we're doing here is we just opened up the software, had that ready to go. So that's the user manual there. Then here I'm just pulling out the power cord. Basically all you do, USB on one end, plug that into the laptop, and then there's just like your little stand for the wired scanner. Take that, plug it in, and that's literally all there is to connecting it. So now that you've done that, you can see the lights come on. It's now connected, and that's just one of the scanner tips. Go in, open up, new case, type in, I think this instance, I can't really see it, but I'm pretty sure I just typed like JK test. Start it, then you click scan on the top right. Opens up the software. Now you're connected. Now you're ready to scan. You can see on the bottom right down there, just kind of showing you what the lens is picking up. So it's quite literally plug and play. Only difference with the wired scanner, you would just have like a, one of the adapters that you plug in to the side instead of the USB, and then you would just connect like so. So very easy to set up and connect.
Yeah. When I got mine, I'm stubborn. I didn't want to call Jordan or Chris or anybody and ask them how to actually set it up. I just wanted to play with it. With the laptop, everything was there. I just opened it, started plugging things in. Within like 2 minutes, it was ready to go. There's like a little USB port that plugs in for the wireless one. Sends a little, Bluetooth signal to the scanner. It is really that easy. To kind of get going. And like I said, if you're in any kind of tech savvy, and I'm a older millennial, I'm not the most tech savvy. It makes it a simple process. There's nothing like stress about getting something brand new in the office and worrying if it's going to work or not. So we're going to roll through a true patient getting a full arch scan. So there are circumstances you're going to need an upper arch with the palate, lower arch, and a bite. This is one of my assistants kind of rolling through it on one of our patients. The kids really do like it because like they're kind of, you can kind of play with it beforehand, kind of show them what you're going to do. You get your impression made as they're going through it. You can show it. You can spin it on the screen. You can show them where their teeth are, or you might be moving things where there might be a sick tooth or something. The visualization of it is really nice too, because you can show a parent an x-ray all you want. I have AI integrated into my software where I can show them tooth parts on an x-ray all I want. You can even like have them look over your shoulder all you want. But when you like do this impression on the screen, it really blows it up and it gives the parent like an easy access view of what's going on in the back of the mouth where it's dark. And they'll be like, oh, that's that tooth. That thing is gross. No wonder we need to take it out. So it's great for patient education too. So she's already done the upper lower, and right now she's getting the buccal bites and kind of putting the arches together. And in that sense, she's done. That was obviously sped up a little bit. It's not that fast, but it is quick. You're going to get all that done in just a couple of minutes. The kids love it. They think it's super cool. And then, if they're really interested, you can play with it for a little bit. If you had a 15-minute appointment and it took 2 minutes, let them play with it for another 3 or 4. And you made a happy kid, and they're going to leave ready to talk about it with their friends.
Dr. Lynn, do you have like music set on yours?
This did not have music. The volume's up.
Because when we went to Vauxhall for training, they had like the Super Mario theme, and as you're like moving around, it like does the Super Mario theme, and when you stop or have to like redo, it stops. So it's like makes it even more. I have to get that integrated. I didn't even know that was a thing. That's super cool. That would make it even a more pleasurable experience for your patient. So I'll have to
I'll have to reach out and figure out how to integrate that. I'm sure it's probably like just a click of a button on there. But I did not know that. So thanks for that, Aaron. All right, this is another team. Their assistants are learning how to play with it. They're practicing on each other after hours. It will make this little noise as you're going. They could probably switch that noise to the Mario theme. That is a little more
You have
pleasant.
to go back to already
So
scanned.
that noise is
Take
the
it back.
noise that you can change to have like music or like Baby
Okay.
Shark or Mario or whatever you want.
Yeah,
And
you can
this
put
this
anything.
doc, huh?
You can put any music, like college theme, like game
That's
day
awesome.
music, whatever you want.
I'm gonna put some Bucks music on there. That's awesome. But this doctor was showing her. I can play this one more time. Kind of as she's going through. There's a little box that kind of goes over where you're scanning, and screen right there. Um, when you lose your spot, it just turns red. So you lose your spot, and you're like, oh,
It stops.
where did I
You have to
go?
go back to
You
a
just
already
go
scanned
anywhere
area
that
to
you
pick it
scan.
back.
It'll pick it right back up, and then you can kind of just keep rolling with it. It is, a learning curve, but not a hard one. If we're used to working in the mouth, assistants are used to working in the mouth. They know their landmarks intraorally. Makes for a smooth impression. And a lot of my team actually had fun playing with it while they were learning. Now, after you scan, so like the scan itself, boom, easy. You're in the actual scan software. If you are going to utilize a lab, some labs have portals, some don't. My lab, NeoLab, does, and this is all already on your laptop. That makes it like even easier. All of these are little templates that you can put together. We have templates made for obviously the most common appliances we make: your lower linguals, your Nances, band loops, mouth guards, just like all the bread and butter things that you do. You can have it all preset and ready. It's really kind of idiot proof. They have an even newer kind of function on there where it has a little image, and you just scroll over the image and it kind of shows you what the appliance is. So if you're unsure of what they labeled it as, you can get that. When you're going in to do it, this is going to be a little walkthrough of kind of how to do it. And it's just showing like, hey, let's pick a template. They're going to pick a Nance appliance. We make a lot of Nances in pediatrics. You're just going to pop your patient's name in, and then it just kind of templates it out based on what appliance you're making. You can change the color. You're going to say like, what type you want, what scanner you're using. And then a lot of it's preset. So like the majority of our cases, it takes my assistants less than 30 seconds to do this, because when you're doing an ANTS, it's usually on the 6s. And you're usually just going to pick a color that's generic unless you have a kid that's really wanting to be fancy. That little image that popped up, that was one of their little like kind of images that show you like this is what your band coverage is going to look like. I love the 3D printed occlusal coverages that they do. It doesn't sit subgingivally, which is a huge benefit for those partially erupted 6s. When you have the distal operculum hanging over, or you just got a really, really tough kid that does not like stimulation in the mouth, you can ensure them that they're not going to feel it, because it's just going to rest on the teeth. It's not going to touch their usually bloody gums because they have gingivitis from not brushing. Once you have everything set, you're just going to hit send to lab. Obviously, this is where you'll come in and check as a doctor, make sure everything's good to go before you sign off on the script. But the NeoLab portion makes it very simple. And after you do one of the cases, you have a template set. And there's really only so many appliances we can make. And if you want to make something else that you're really not sure what to do, you can call NeoLab directly. They're very responsive, and they get on the horn and walk your team and or you through any new that you need to put in place. I'm going to roll to the next one. Obviously, habit breakers. This is another template. Again, they all look very similar because they're almost the same. The really nice part is the little images that they put in. So like my new assistants, when they're like, I call something out and maybe they're newer to pediatrics and it's a Halterman appliance that they've never done before or something, then we can kind of, show them, hey, like this is what we're looking for. This is what you do. They learn it once. It's a plug and play, makes it simple. Same thing with your lower linguals. I love these 3D lingual arch impressions, and and getting those back because they fit so nice. And I'll roll through some cases where that can be beneficial for you guys, and I'll show you like the physical of what the intaglio looks like on those. I was pretty hesitant, just thinking retention on these was going to be poor, but I utilize the like the Fuji Ortho Blue cement. If you have band lock, it's going to work even better. And these things, like I've been taking them off now because they've been on for a couple of years, and my appliance has done their job. Premolars are in, and they stick, man. Like they're way harder to get off than some of my old, just Fuji Sim 2 bands that you put on there, and makes for a much cleaner gum line, and makes for just a nicer appliance delivery. Again, your Nance, all the same stuff. This is like a little cheat sheet. We have these kind of printed up and then out for the assistants. So if they need to understand, like, what do I need to get? Most of them are going to be a full palate scan if you're doing an upper arch appliance. But it does give them the ability to know, like, hey, do I need the palate? Do I not need the palate? Am I just doing a quadrant? What's needed? And then it also gives them a visual, like what does this appliance look like? So it's a good learning tool for your team. They can kind of understand, hey, we want these teeth in play. We want to rest against these portions. So when you're getting that impression, we need to capture that anatomy. And I've been doing a lot more mouth guards with them. Because they're so easy and they fit so nice. And my real athletes, like my hockey players, my football players, the ones that like have to wear those, and they're getting strict on them, which I like for concussion protocol stuff. I've had nothing but good feedback. Like, this is the best feeling mouth guard I've had. It fits so well. It doesn't poke into my, gums or vestibule, which makes it sweet. So band options, obviously you have the doctor fit. That was my bread and butter. Like, I wanted that band all the way adapted to the occlusal surface. I didn't want any air gaps. I wanted to make sure it was really going to be retentive and kind of hold with the cement we're using. Obviously, if you do this, you're going to scan with the bands on, or you're going to take an impression with the bands. You're going to scan without the bands and send them. But there's a double mail if you do that. Obviously, indirect, you can just take the scan and say, hey, send me the Nance or the lower lingual. You'll have to squeeze it through or place seps before you do it. An easier option, but again, it's not always the best fit. The 3D SLS is what I've been using the majority of the time, because it does not sit subgingivally. It sits super gingivally. It really only bonds to the occlusal surface of the tooth. The intaglio is very micro etched, so there's a lot of surface area there, and that's what gives you that really good bond. When you're doing it, I do utilize a light cure option, so I can kind of get it set and make sure it's not going to flop around. But what's cool about these is you can make this little 3D SLS coverage almost any way you want. If you want more occlusal coverage over it, like you want to kind of cover the whole top of the tooth, you can. If you only want like 3/4 of the tooth covered because there's still a lot of gingival overhang in certain aspects, you can do that. They have their protocols where they'll be like, hey, this is what we want. And then I'll just call and be like, hey, I know this is not perfect. I still want you to make it because it's going to work. And every time I've done that, they're like, okay, we can't guarantee it. It's worked perfectly. And it's helped me get, some patients with special needs, or I have a sedation coming and I really want to get this on during sedation so we can utilize the benefit of that without having to fight for an appointment. It made it a much smoother process. And no bands to send, which makes your life easy. And the 3D printed option is just such a clean fit. It drops in every time. Obviously, no seps with the 3D SLS version. You're still going to debond the exact same way. You can use the same cement that you've been using. For me, I did switch to a light cure option for these just so I can get in and get out. But at the end of the day, that's like 90% of the appliances that I make have that 3D SLS occlusal coverage aspect. This is just a traditional band and loop I did with it. I utilize the chairside kits, utilize those a lot today in sedation, Jordan, and worked out well. But if you don't want to make a chair side, or it's just an awkward situation, or you have time to have a band and loop prepped for a sedation case, that's where you can kind of do your traditional 3D print the model from the scan. They're going to put a band on there and do what you need to do. Obviously, the fit's perfect. I used to always have to adjust my band and loops when they came back from the lab. I don't know if it was the turnaround time, the impressions that we made, or the lab technique with the soldering, but I always felt I had to have a 3-prong or a bird beak and and modify my band and loops a little bit. I haven't had to bend a wire with using the scanner since. And then this is just a copy of one of the lower linguals that kind of middle, you can see it upside down and it looks kind of like diamondy. That's that kind of micro etched surface. And you can see how it kind of just sits on the occlusal third of the tooth. And a lot of times I'm utilizing these where those sixes are still just have that little distal overhang. So I'll have them just say, hey, don't touch the soft tissue on the distal. Make sure nothing's touching there, just so when you put it in on those really jumpy kids, it fits super smooth and you don't have to worry about cleaning issues and or just impaction on the gums, making it uncomfortable with cementation. So this was a very non-traditional case that I did. I do MacGyver dentistry sometimes as a pediatric specialist, kind of need to. This young lady was petrified of everything, would let me get in her mouth, let us take x-rays, but wouldn't let me really do anything. She needed this tooth out and irreversible pulpitis. So we were like, hey, let's get her sedation. But mom, my sedation's not for a couple weeks. Let's get a scan done. The lower anteriors had not converted yet. I'm not a huge fan of throwing a lower lingual on before 23 through 26 are in, because on a kid like this, I have to take it off, let them grow in, re-cement and or refabricate with a new impression. Didn't want to go through that. And the distal operculum on this number 30 was hanging on a little bit too tight. I said, hey, we're going to throw this out there and try to make a little modified band and loop with just that 3D SLS coverage. It's still in there today, knock on wood. And this was probably in 2023. And I saw her not too long ago. She's grown up a lot. And I tell mom all the time, when this comes off, we're going to switch to a low lingual. She's come a long way behavior management wise, but still holding strong. Glue's doing its thing. I'm going to leave it there because don't poke the bear in a sense. And it just gave me an option. A lot of times I'd have to say, we could throw a lower lingual on, or, hey, we'll deal with space loss with ortho down the road. But this just gave me an in-between option that mom was on board with. Again, this is one of those 3D kind of SLS printed options where we needed to kind of get them on. The distal of 14 had a little bit of tissue overhang. This was a very skittish kiddo that we got the tooth out on. It made getting it in a lot easier because I promised him, I'm like, hey man, the impression's gonna be easier than the delivery, but the delivery won't feel a thing. You're just going to taste a little glue. And he was okay with that. And it's still holding on, doing its thing. One of those just makes your life easy, makes your parent and patient happy type situations. This was a kiddo that I met like this day, and he was older kid, but still very jumpy in the chair. I think we might've been his first dentist appointment he ever been to. He had an abscess. Talked him into, hey, let's do this today real quick. We had the time. We used the Soan and got him numb. We did his impression. So I'll kind of speed through the impression here. The actual, yeah, it's going. No, doesn't want to go. But at the end of the day, I'll kind of click through this. I was able to get him numb with the Soan in 5 minutes, do a scan in just a couple of minutes. You can see the heme from my actual injection with everything, and then got the tooth out all within 15 minutes. The parents were super impressed. They brought their entire family after this just because we got good customer service, took care of them, did what we're supposed to do as specialists. And the kid was a champ, did not have any issues. The Soan got him super numb. We were able to get him out of discomfort. And 2 weeks later, we delivered his Nance, easy peasy. These are the kind of things that can make the ROI even better, because things that would traditionally have taken you an hour, you got to do a full arch impression. You got to do a traditional infiltration. You got to go through the papilla, get the palatal numb. All of that takes time. We were able to kind of squeeze them in a little 25-minute slot and get a lot of same day production done. Happy family, happy office. Everybody was in good spirits after that. Oh, there it goes. Now it wants to go. There's just another kind of prepping for sedation case. Obviously, we're doing a full mouth rehab here. We were losing K. I think we lost T as well. Not sure there. Wanted to kind of make sure everything was good on the delivery side of things. I'm always thinking like, hey, if I'm going to go to sedation and put something in, how easy is it to get off? Or if I need to deliver it down the road, can I do that? My anesthesiologists that come absolutely love that I have a scanner now, because I used to throw a full arch impression in on a open airway IV sedated patient and block the tongue and the floor of the mouth, and that's never a good thing. This makes it a lot smoother getting those impressions if you are doing them in sedation. A lot of times, if the stars align, I'm going to try to prep the kiddo or parent before and get them in a few weeks before sedation so we can get things delivered in and cement the day of, so it's all easy peasy. This is just another added benefit that they have. I'm gonna see if this works, Jordan. Sometimes it does, sometimes it doesn't. And then Jordan can walk you through some of this. So this is just like a AI assisted oral health report that you can use the scans for, and it's more for like.
Casey, we can't see. You might have to slide it over or do whatever.
All right. Let me share this. Aha. I'm getting there, guys. Like I said, I'm not tech savvy.
There it goes.
All right, let me pull it back. There you go, Jordan.
So what this is after you've taken your scan, this is your oral health report. So you were to kind of just open this up. It's an application you can use just with any scan you have. And then, so what this is showing you is you can go through, add shading, do whatever you want. But the neat thing about this is that you're able to use AI to essentially generate a oral health report and kind of do a lot of like the legwork for you. And you can go in and edit sort of everything in there for you. So what this is going through, this is before the AI is kind of kicked in, but this is just taking your scan, you're going through, attaching your images and everything else, and you're able to send this off with the patient. Now, the AI assistant, this is what I was talking about, where you can, use this. It's going to use AI and kind of do all of that legwork for you. If you don't like anything that you've seen, you can go through and you can, edit any kind of notes, anything else like that. But it's going to walk you through, like you can see there, description, suggestions. It's going to point out, some of the problems. And then you can actually save this, add it as like sort of like a packet, like a take it home kind of thing. You can, do some other, settings and preference stuff that you would like. Of course, you can attach images and any kind of files that you'd like with it. So it's just kind of going through, being able to show you. So this is one of the new, and there's your kind of oral health report like packet that you could actually like print out and send home with the patient if you wanted. And then, but again, this is just sort of one of the new applications that you're able to use. So up at the top there, you can see all the other applications. So constantly updating, constantly doing everything. And of course, that is all included. There's no fees whatsoever, as you saw one of the previous slides. So constantly updating and adding new kind of features, a lot of it, AI stuff. So in Casey, have you gotten around to playing around with this yet?
Me and my assistants were playing with it with one of their cases that one of my team members is going through Invisalign with one of our orthos. She's like, what was that thing? And I was like, oh yeah, let's play with that. I haven't utilized a ton just because we don't do like super big comprehensive cases, in pediatrics too much. But if I'm doing a kind of prep for ortho, like bonded lateral type case, that's when I think like this would be really beneficial before I get like a wax up back from the lab or anything like that. You can kind of give them an idea of what you'll be prepping for, and hey, we're going to move these teeth and do this. But at the end of the day, it's just one of those added benefits. All right, I'm gonna see if I can kind of go back to sharing my actual screen. See if I can do this correctly. Hey, look at there.
Welcome to Huberman Lab Essentials.
Oh, I'm hearing something.
Past episodes. That's potent and actionable.
That's the
science-based tools
actual
for mental health, physical health, and performance.
YouTube.
Oh, there you go.
Let me go back. I thought I had it smooth this time. Got to remember to turn it off. All right. So jump back into kind of the nuts and bolts of why we do things as business.
If Casey can use the scanner, you guys can too.
ROI, like we need a return on our investment. biggest takeaway we talked about right away, no more real tray inventory material costs there. It's going to cut down on your remakes tremendously. You're not going to have to send something back or have something break because you're having to bend something too much, or take a banded loop and turn it into a one-arm banded or something. The savings on the lab fees come from that. Like, you're not doing back and forth 2 times. It's only one shipping cost. And no remix makes for a happy doctor, happy lab relationship. The biggest thing for me in the tangible ROI is the chair time saved. Having the ability to take a scan, utilize like a SOAN, get things numb, get the tooth out, or do what you need to do from a restorative side of things really quickly, just means there's more production available in the day. You can do more things and help your patients out quicker without having to wait and come back to the office. Parents really appreciate that, as you all know, especially if there's multiple SIBs and busy lives involved. We are big on keeping appointment times long, so we have plenty of time to speak with parents and not rush kids, but also keep them production quick, where we know this is going to be a certain time procedure. This lets us shorten some of those times. The thing I didn't think about right away was the inventory of models. Old school ortho, when I was doing some phase 1 cases, you have to like take that lab case back. You got your models, you got to put them away for inventory. You got to keep them for 7 years, whatever the law is. You can 3D scan every one of those models in your office and have those stored in the cloud. So if you have an entire closet of models that you've accumulated over the past 20 years, you can have an assistant sit there and scan them all, and then you can utilize that closet for something else. And then what we talked about, the obvious, like faster impression, faster delivery. You're not waiting on things. And the fit to me is just the biggest thing. Not having to adjust anything, knowing it's going to fit really nice, hit the right landmarks in the mouth, and not have to be something you're fidgeting with for 10 minutes while you're just trying to do a simple cement case. Makes your life very simple. Long term, new appliances, you're going to be more inclined to try something different, because like you might be like, hey, well, I've learned about this, or this is something I did in residency once, but I don't want to have to go through with taking those impressions and going back and forth, and I don't know if it's going to fit and blah, blah, blah. This has made my life easier in the sense like, hey, we can jump into offering these things now. When I was doing aligners before, I would have to take PVS impressions. It'd have to be absolutely perfect. And a lot of times I'd send them in and they'd be like, nope, you missed this, XYZ. We got to get new ones. And you have to bring somebody back to the office. I use OrthoBrain as an aligner company. It has an orthodontist that kind of helps you along with the case, so you're not like doing it fully solo. You can use any aligner, Angel aligners, anything you want, as long as they accept the STL file. So pretty much anybody but Invisalign, who's got the iTero exclusive, and it's opened up that opportunity for me. My son's in a phase 1 aligner case right now. He's my first phase 1 kid. He's my guinea pig, and he's doing pretty good. He likes to ruin his attachments quite often because he picks at them. But other than that, it's been really smooth and everything fit really well, which was nice. Your procedural confidence will be higher. So you're going to be like, yeah, we can do that. Super easy. And, we're not salesmen, we're healthcare providers. But when a parent's on the fence and you're really confident about the outcome of that procedure or the outcome of how that appliance is going to fit and how it's going to help their kid in the long run, they're going to be more accepting of that case, and they're going to be on board to kind of go through the process with you. And then marketing, like, use this as a tool to highlight your practice. Like, hey, we brought this in to make our patients' lives better and to have better outcomes. Put it on your website, put it on social media. Your referring dentists are going to love that you're able to do this stuff. And I used to have to send my patients, if I couldn't get an impression, to one of my local orthodontists to get a scan, and then he have to send it back to me or ship it to the lab or make it for me. Now we don't have to deal with that. So like, your referral sources are going to be happier as well. And the other things, like the long term, like this scanner gives you the ability, if you want to learn some 3D printing and you want to start playing with those kind of things in the long run, you now have that option like at your fingertips. And that's what I'm looking forward to in the next decade. I do feel like we're going to be utilizing more technology in our day-to-day practice, and just helping the growth of kind of the digital atmosphere in that sense. So, purchasing options, like these are the things you guys came for, obviously. You're going to have a 3-year warranty on everything. It comes from Voxel Dental. They were in the general dentist space for a very long time, and they've kind of expanded to this. You can get it with or without the laptop, with or without cord. You have options there. I picked the laptop included because all in, it was still a very affordable price in the scheme of what a scanner is, especially when you're looking at the recurring costs for some of them. And then all the tips are autoclavable. So just like if you are taking intraoral images and you have mirrors, if you cover the little top with a gauze and then roll it through sterile, you're going to get a little more lifetime on it. Jordan, what is the normal amount of cycles autoclave wise that you can get?
I think covered under warranty is 80. But to be completely honest with you, I think doctors are like doubling that.
I would say easily doubling that. Like I haven't had to get a new tip.
Yeah.
Knock on
Yeah.
wood.
So like we really don't see a whole lot of like refill orders for those. Honestly, and I just tell people like the easiest way to just to prolong them is just put like a little piece of like cotton gauze or whatever just over the mirror when you autoclave them, because the only reason you'd really need to replace them is if that mirror, ends up kind of going bad, you get spots, stuff like that. So if you just put a piece of cotton gauze or whatever on there, it's going to really help out. A couple of things real quick, Casey, is we actually, the AS260, the wired version, is actually a new lower price. It's $1,000 less than it used to be.
Wait.
So even with tariffs and everything like that, price actually went down, which is pretty cool. And then the partnership with Voxel, like you talked about, they're in the general space. They do the onboarding, the support, and stuff like that. So I know Casey didn't even really need it, so he just kind of jumped in and went ahead and did it. But if you do choose to do the onboarding and everything, that's completely free. You have full onboarding and support, a virtual call, and they'll get you all set up and walk you through kind of everything you could possibly want to know. So yeah, that's our partnership with them as well.
All right. So these are your people. If you have any questions on purchasing the scanner itself, obviously you met Jordan and Aaron. Chris is also available for you guys. These are their contacts. Awesome group of people, very helpful. I reach out with stupid questions sometimes and they get back to me right away. They don't judge on any of those things. And then for me, I'm an open book. Like if you guys have questions, things that you're thinking about, cases you're working on, or you have something like, hey, how do I do this? I've had colleagues of mine that get the scanner and then, text me, call me, and they're like, how did you do this? How did you do this? And kind of help them out with what I do on the day to day. It's really not rocket science in the scheme of what we do every day. This is one of the easier things now in my office that we do. And then NeoLab, if you guys are interested in them, just give them a little shout out. They've been super helpful and beneficial in my practice growth as well. And I think that's it for the actual
Sweet.
side
So
of that.
we can jump into questions. I will let Aaron kind of go ahead and take these away. And then again, if you have questions, please put them in the Q&A. So while you have Dr. Lynn here, he can answer whatever else for you. So go ahead, Aaron.
Yep. All right. We have 2 questions so far, but like Jordan said, throw them out there if you have questions. Like, there are no dumb questions, or we'll try not to make you feel dumb. One thing I did want to say is that like I said, I got trained by Voxel not that long ago. And the first time I had the scanner in my hand, it took me a minute and a half to do my upper arch. It was my first time ever doing it. And then 30 seconds to do my lower arch, which is like 1 second of training. So it really is like super easy to do. Okay, first question is, what did you say got the patient numb? Sounds like you said Sloan. I can answer that one. That is the SOAN. Yeah. And that is another device that we sell through New Smile Tech. It's the intraosseous anesthesia delivery device. Dr. Lynn, if you want to expand on what it is and how you use it in your practice.
So it's a fancy anesthesia device. It has made, like, I was hesitant to get it. I remember when I bought the scanner, I was talking to them about the SOAN and I was like, dude, I give painless anesthesia. My patients don't know. It costs me like 60 cents a setup. I don't need something fancy. The SOAN is an intraosseous device. It's got a patented tip on it, allows for direct anesthesia, like to the bone and roots of the tooth, and it's automatic anesthesia. And the scalp, the tip of the needle is shaped more like a scalpel, so it kind of slides into the papilla without the patient feeling it. And then you reorient it, go into the actual bone. They have a great webinar on that, but it's a game changer. Like some of my mentors that I've looked up to since I started pediatric dentistry were like, Casey, I've been doing this for 20, 25 years. Like this has been one of the biggest things I've ever added to my office. So I pulled the trigger on it, and it honestly one of the coolest things. I talked to every parent about it. Every parent's like, why does my dentist not have this? It is a big practice builder, and it allows for very quick turnaround because it's automatic anesthesia. It's not as long. You don't get 2 to 3 hours. You get about 45 minutes of anesthesia, but it's fully pulpal. You can put the SOAN down, pick up your handpiece, pulp the tooth, put down the SOAN, pull out your forceps, take the tooth out. Makes it very, very simple in that sense, but really cool. You guys like it.
And there's no collateral numbness, so the kid won't bite their tongue and cheek.
No numb lip, like no lip injuries after. Amazing. Yeah.
So if you have any questions about that after, hit me and Jordan up. We're well versed in that. So definitely hit us up if you want more info on that. All right, next question. Dr. Lynn, would you please repeat the name of the cement you use for the bilateral space maintainers with the overlaying distal gingiva?
Yeah, so it's like the Fujisim Ortho Blue. So I use a lot of Fuji products in my office. I'm a big glass ionomer guy. And I've always used Fujisim too, like the pink one, like for my band and loops and like my full banded kind of cementations, my crowns. That's what I use for those. But I wanted something that was light curable. And they make a blue cement that has a light cure component. So it's like a resin modified glass ionomer that has the ability to cure. Just get it through your GC rep or your Fuji rep, whoever you guys utilize. I use Benko. And I was like, hey, I want the blue cement that's curable. And they got it for me. And it's the same exact delivery as you have for your Fujisim 2. I don't use the little tips because I'm cheap and I think that's material waste. So my team just squirts it out and mixes it and then puts it in the band. But it works really well. And you could also just get the band lock that your orthos use too, which is a blue cement as well. Very similar. I feel like the band lock's even like tighter. So if you're really worried about debond, use band lock, but I've had a lot of success with that.
Awesome. All right. My kids ran in the middle of your presentation. Does the scanner work as an intraoral camera too?
Gotcha. Don't worry, Kevin. My kids are upstairs right now, or they'd be running in the middle too. I don't utilize this as like a intraoral like camera, but I do use it as like an intraoral education device in that sense. Like if I need to like do impression, I use it to show parents. I have a bunch of intraoral cameras too that I have linked directly to my intraoral or my imaging software, but you can use it as an intraoral camera because it gives a really good clear visual of the tooth. So for patient education, like absolutely, it's definitely something to utilize.
Awesome. Any other benefit of the wireless scanner compared to the wired scanner besides it being wireless?
I would say, like, I don't think so. Like, they're essentially the same thing. It's a little bit heavier, so that could be a downside. I just don't like cords. That's my big thing. Like, I like it clean. I like to have as much no cordage in the office as possible, so wireless as much as I can. The corded version, you're going to have the same exact components and the same exact software. How you use it's the same. You just have a cord attached. And we just have like a little Amazon cart, and then we just have our laptop on that with the scanner sitting underneath it, and we just roll it to whatever chair we need and pop it up, and you're ready to roll.
Awesome. Are orthodontic separators needed prior to scanning, or are needed more for seating the appliance only?
I would say if you're doing a fully band subgingival, I never even, when I was doing those, used seps. I'd just be like, all right, give me a band pusher and just shove it through. I would say cementation, if you want to make it really nice, yeah, put some seps in, wait 10, 15 minutes, then go back and cement your appliance in. But you don't need them for the actual scan. You can just send the scan off, and they'll make little slices on the mesial of one tooth, distal of the other tooth, so they leave your actual tooth, your banding intact, and they'll fit a band for you if you're doing that kind of indirect route with them when them fitting it for you. So you don't need the steps for the impression. If you want to be nice to your patient, then yeah, you can use them after.
I appreciate everyone for joining us today, spending this hour with us. Casey, anything you'd like to add? Closing note, anything?
No, just appreciate you guys taking time on your Tuesday nights. If you have questions, reach out to them, reach out to me. We're here to help, and hope you all enjoyed it.